the importance of communication at every level, whether you are a student, you are a doctor, you are a professor, every level, communication is important. And even it's also a part of relationship. There are no few skills not taught in medical colleges. We had developed a course titled Skills Not Taught in Medical Colleges. And this is part of it. Like, when we are studying, indeed, this is something very, very important. What Sir has introduced, even I learned out of it, that it's not only that after you become a doctor and you communicate, that even as a student, you communicate. As a student, you are communicating with your professors. Suppose if you communicate nicely, then teachers are always ready to help you. Sometimes if you don't communicate properly, even they won't get the message right. At times there are even cases, maybe at postgraduate level, that maybe registrar was so arrogant with the professor, and then teacher was really disturbed. That maybe he had an ego that I know more than professor or something else. And then even teachers were disturbed with that registrar or somebody. So communication part is very, very important at every level. And why it is important? Like, let me tell a little bit, which probably as a doctor we don't know. What is called time management. In time management, what is recently being taught is supposed to be the 4 quadrants. They say there are 4 quadrants. Although I'm not going in details, I just want to share something important. Like these 4 quadrants of time management are, like there is a part important and urgent. There is some activity important and urgent. Say for example, now I am in OPD, but because for this session I had given my consent, so I have to attend. No, it is important as well as urgent because I had said yes. Even if patients are there, I should tell them to wait. Likewise, there are so many activities which are urgent and important. We would always attend. There are activities which are important but not urgent. So we tend to postpone them for a long time. They are important, but because they are not urgent. There are activities which are not important, not urgent. So, and there are activities which are important and not urgent. So likewise, we can divide it into 4 aspects. This communication part or a human relation part falls into something which is important but not urgent. It is very, very important because like in medical profession, it is very well known that whatever treatment you give to your patients, now there are thousands of even double-blind studies that at least 30% effect is a faith in doctor. If patient has a faith in doctor, that doctor has properly understood my illness and he's giving me right type of medicine, then he will be cured. Say maybe 70% is what treatment you are giving, and almost 30% is that placebo effect. So that placebo effect is your communication. How you listen to your patients, how you convince your patients that what is the illness, the type of treatment, what you are giving is the right treatment, patient is going to get cured by your treatment, whatever. So that's the part of communication. So this is almost 30%, which is really important. And in some cases, it may be more than that. I can give you a large number of examples. Like now let me share. Right now, I'm recalling one patient. Like I was third doctor. Before me, that patient had anxiety, and patient went to two other psychiatrists, psychotherapists, and no, she went to them, took prescription, but did not took the treatment. The reason, when I heard the whole story, and they told me, they said that the first doctor had examined and all, and then ultimately doctor said that with my medicine, you are going to lose memory. So patient was really frightened and never took the medicine. The second doctor also maybe could not convince properly. And when they came to me, no diagnosis, everything was okay. I told her that, look, nothing is going to happen. You don't worry at all. And I'm giving you in a specific way. And with this medicine, there is not going to be any side effect. I'm giving you lower dose, as well as if anything happens, I'm there. You don't worry, I'm available. So with that little bit of encouragement, with little bit of confidence, when she took the medicine, today she is absolutely fine. We are even in the process of stopping her medication. So likewise, this communication is very, very important. This is just a simple example which I could recall right now, I told you. So this is the part which I said in time management, something which is important but not urgent. So there, generally, we don't do this. What is important and urgent, we'll have to do. Suppose if you have to complete some assignment and give, you will have to do it. Even you will, maybe at night you will do something, but complete that assignment. Whereas this sort of activity, we don't give priority. So my point here is, we need to give priority on these communication skills or human relation skills at every level. Not only in medical profession, maybe this relationship skills are required at home as well. With your parents, with siblings, with spouse, with everybody, these human relation skills are very, very important. Now, even I was told to link the part of attitude also. Now, how attitude is important? This attitude can come at two levels. One is attitude towards this particular skill itself. In one of the session itself, we had a session in Bangalore where many doctors were there. And there was a cardiac surgeon, a very famous cardiac surgeon. When we were talking all this, ultimately he says that I believe in operations. I don't believe in such sweet, sweet talks. He was quite senior. I did not say anything, but indeed I thought that there are now research studies, in fact, that what happens. Let me share a research study. In this research study, what was done, that these patients were supposed to undergo bypass surgery. Everything was same. Say the hospital setup was same, anesthetists were same, doctors who were operating were also same. Only difference was they trained those anesthetists that a day before, when they went to the patient for basic checkups and other thing, like there was only that little difference was there. Like in one group, they went to the patient and spoke to them rudely. That, look, tomorrow is your operation. Don't ask me much question. We know what to do. It's okay. Tomorrow you are going to be operated. No, we have given all the instruction to the nurse and we will do the needful. And they went away. And in the second group, doctors went to the patients, sat close to them, and properly explained that, look, tomorrow is going to be your operation. You don't worry at all. We are going to take care. If you have any questions, please ask. And always patients have some questions. Whatever questions were asked, their insecurities were there. Everything was answered properly. And only on this basis, when they found out that post-operatively, what was the difference? Like, recovery was much better where things were explained properly. Even complications were much less. Need for those medicines for complications were also much less, where proper explanations were given to those patients. So this is a classical, well-published study which shows that how we communicate with our patients is very, very important. Not only this part. Now, though, maybe it is something what I am saying is a bit jokingly, I say this. At least in metros, like I'm in Mumbai, in bigger cities, there is so much competition. And with this competition, patients have all the possibility of going to any doctor they need. So they have all the options. So if you don't communicate to them well, if your behavior is not good, then these days, even right now, it has already started. Before coming to you, patient is going to Google your name. And there, wherever you are, maybe on Just Dial, on Practo, on Google, your rating will come. And if your rating is low, patient understands that he's not a good doctor. So this happens, how you deal with your patients. How well you communicate with your patients, how nicely you explain them is indeed important. And as still further the time goes, indeed the competition is going to increase. And there, if you want to really be a good doctor, a successful doctor, it's a very, very important skill. Even your attitude towards maybe your colleagues, your juniors, your seniors, everything is important. Even if you're a teacher, then your attitude towards student is also important. Because if you enjoy teaching, then you will do it better. If you don't enjoy teaching, then you won't be able to put your heart into teaching, which is also indeed very, very important. Now, with this background, let me share simple and practical aspects. What I'm going to share is perhaps not very something hi-fi things, although they are simple, but quite important. If you follow that, it is going to help you to a great extent. Let's talk about, say, patient. As soon as you see your patient, like your first, when you see your patient, if you smile, it's going to make a tremendous difference before you say anything. When you give smile to your patient, then that gives a powerful feeling that this doctor is interested in me. He's empathetic. He's going to help me. Lot of smiles is lots of things. So even if you are tired, even if you are under stress, even if you have certain difficulties, do keep smiling. No, smile is an precious possession, in fact, no, precious gift, in fact, which you can give it to your colleagues, your patients, your seniors, your juniors. Plus, become a good listener. Communication is not only what you say, but how you listen is also very important. Like when you are listening, pay a full attention to patient or anybody, like it can be your colleague, somebody else also. Like when you have a complete eye contact with person who is communicating to you, that shows a sort of an interest. Your body language is also important. Like if you bend little forward when you're listening, that also gives a message that you are interested. In between, if you nod, that also gives a message that you are interested. And to be a good listener, don't cut anybody in between. Because if somebody is speaking and when you interrupt, that gives a feeling that that person is not being heard, or as if you are not interested in that person. So let that person complete the whole thing and then only speak. At times you may be busy, I agree. So maybe you can say that, please tell me briefly, that's perfectly fine. Or even you can say that, no, in next visit, I will listen to your problem in great detail. Right now, no, please tell me briefly or something like that. But let them complete. And once they have completed, then only we should say something, whatever you want to explain. Here, at times, even in my profession, like mental health, when I talk to mental health professionals, they say that, no, this is going to take a long time. We don't have so much time. But believe me, your overall success rate is going to increase tremendously if you are a good listener. So communication also means that you should become a good listener. Apart from that, suppose if we say, no, when we are talking, when you are saying something, so when you want to say something, first of all, say, for example, when there is some difficulties, say among colleagues, with seniors, with juniors, there may be certain issues. There may be some problems. And then they are communicating to you. So in such a state, when they have said, then you should repeat what you have understood, rather than jumping to conclusion and immediately replying. When you repeat, like I will tell you today's example, although this is a sort of a family counseling, there is a patient in USA. Today morning only I was counseling. Today morning only I was counseling, and this lady told me that probably she said something that when my mother was there, she was, maybe, their elder daughter, she was not eating properly. So she said that when my mother was there, things were okay, like, she was eating. So immediately husband said, this means that my mother is not feeding child properly. So that resulted into a fight. Rather than the same thing, if he would have said that, no, I have heard this, and this is what is the meaning, something like that. That you said that you are feeding, you then no, whatever he wanted to say would have said in an entirely different tone. That communication was such, and because of that, it resulted into the fight. So, in communication, lots of precautions needed to be taken. Now, coming to the communication with, say, with patients. In communication with patients, most invariably what happens is, remember that patient is always impatient. And doctor should not lose his patience with patient. Remember this statement. And patient might be asking same question again and again. So rather than answering in some different tone, one of my friend only, even he even told me that, Girish, they are asking, I said, baar baar puste, ek baar to diya. Although you are right, but then patient will get message that this doctor is getting angry. This doctor got angry on me. And if you are in a private practice, second time he has option to go to somebody else. So, in what we should do, even if they are asking repeatedly, you answer. Or suppose if you are too busy, you can even train a junior who would be answering all the questions. So that no, your time is not wasted. You can say that he will answer all the questions. Still, if you have something, you can ask me. But answering all the questions, whatever their queries are, their peacefully is very important. Suppose if you are in a government service or something, and then too many patients, then also rather than becoming angry, show it with some body language. One pediatrician himself said this. He said that being a pediatrician, with one child, there are 5 relatives. And in government service, no, everybody will be together. And it used to become impossible to attend them. So he said that when such a crowd happens and it was difficult to answer, rather than saying anything, I would hold my head like this. And patients would understand the doctor is disturbed. And then maybe they would go a little away or something. So such a body language is fine, but verbally they should not say anything which would disturb them. So now it's as such a huge topic, but say communicating to your colleagues. When you want to communicate to your colleagues, even if it is a truth, don't say in a bitter way. One simplest way is that, please don't feel bad, I want to tell you something. And then wait. Your colleague himself or herself says, no, please tell me what you want to tell me. And then again, depend. If you don't feel bad, I want to share something with you. And then share, don't magnify. Say in a way what it is, rather try to minimize, so that that negative effect is not there. At times, with seniors, we should be very careful because they have their own ego. So if you want to tell them something, we should be indeed very, very careful in sharing. Otherwise, they might always remember that, he told me this in this way, and might remember it for a long time. So there even we need to be a bit careful. And now you might ask that how to inculcate. because this should become a part of our habit patterns. So, like early in the morning, when you wake up and you get up, there is always some time. At that time, think of some positive affirmations. Before going to sleep, think of some affirmations. Even meditation can be a good way. Whatever way you meditate, after meditation, when we feel bit relaxed, then also if positive affirmations are given for the change what you desire in your communication skills. And it has to be done at least for, I would say, for 6 weeks, so that that becomes a part of your subconscious, and then it would become another habit, because no, it's a whole life. Once that skill, soft skill is developed, it would help you throughout your life. I hope whatever was possible in the limited time I have shared with you. Now, if any questions, feel free to ask so that I might be able to answer your questions well. Thank you very much.